Fatty liver disease, also known as hepatic steatosis, is a condition that's becoming a lot more common here in the United States and worldwide. Basically, what it is when there's too much fat accumulation in the liver cells. We know that we need the liver to function normally for it to do what it has to do on a daily basis. Excess fat buildup can actually cause issues and can lead to more inflammation if left untreated. As a result, this can actually worsen liver disease and can make the liver functioning very difficult to do. On today's episode, we are going to talk about non-alcoholic fatty liver disease, what it is, and of course, how can you fix it. Before we get started, this is your host, Diana Butucci. I'm a board certified APRN here in the United States, and it is my passion to treat all of you and educate all of you worldwide. If you are new, consider subscribing to my channel, share this video with others, and as always, feel free to comment below. So let's get started and talk about non-alcoholic fatty liver disease. This is a more common form of fatty liver disease, and it is not related to alcohol consumption. So that's right. There are other risk factors that actually put you at higher risk for developing this form of fatty liver disease. It is often in individuals who have risk factors such as obesity, insulin resistance, type 2 diabetes, high blood pressure, and high levels of triglycerides in the blood. It can range from simple fatty liver, which is steatosis, to a more serious form of fatty liver, which is known as non-alcoholic steatohepatitis, known as NASH, which can be more inflammation to the liver and can damage the liver to more greater severity. Some of the risk factors that I already have mentioned earlier that can actually lead to non-alcoholic liver disease will include obesity, insulin resistance, type 2 diabetes, high blood pressure, high triglycerides in the blood. Actually, rapid weight loss can also lead to non-alcoholic fatty liver disease, metabolic syndrome, PCOS, sleep apnea, and certain medications. So those tend to be the typical risk factors of people who tend to have non-alcoholic fatty liver disease. Unfortunately, fatty liver disease doesn't cause noticeable symptoms in its early stages. Some people may experience fatigue, discomfort, or mild pain in the upper side of the abdomen, but the symptoms may become worse over time, especially if fatty liver disease is not treated. The way that we diagnose fatty liver is in my office. I do routine blood work. I'm always looking at the liver panel to make sure that the liver enzymes are not elevated. We can do ultrasounds, CAT scans, or MRI, which will actually show the fat accumulation around the liver, and that is how we can definitely see and diagnose fatty liver. But normally, a lot of times, we do tend to see it just through routine blood work, and we can see that the liver enzymes are elevated, indicating that there is a problem with the liver and that there's something going on more that we need to investigate. Before we talk about how to fix fatty liver, you're probably wondering, well, why is the liver important in the first place? What exactly does it do internally? The liver actually does a lot more than a lot of us may know, and that is why we want to keep our liver as healthy as possible. The liver helps in filtration, digestion, metabolism, and detoxification. It actually gets rid of toxins in our body. It helps with protein synthesis and storage of vitamins and minerals. For that reason, we really want to know if we have fatty liver. You want to make sure you're getting tested regularly. And if you do have fatty liver, these are the steps that I want you to take. And of course, you should always be in close contact with your doctor so that they can monitor and manage fatty liver as well. The number one thing is, of course, you want to maintain a healthy diet that is well balanced and nutritious. You want to include a lot of fruits and vegetables, whole grains, healthy fats, and of course lean proteins. You want to avoid intake of saturated fats and added sugar. Reduce the intake of processed and fried foods because those tend to be a culprit in making fatty liver even worse. Number two is you want to maintain a healthy weight. Weight is very important. As I mentioned, one of the risk factors of fatty liver is actually being obese or overweight. For that reason, if you want to make sure that you are trying to do everything that you can to lose weight. Even if 10-pound weight loss can actually go a long way when we are talking about fatty liver. So you want to make sure that you're taking all the proper precautions that you can to try to lose weight, normally through physical activity and by eating well and watching your portion sizes. Number three is exercise regularly. The benefits of exercise are very well known to many of us, But whenever we are exercising, it actually helps keep our liver healthy, and it can help aid in getting rid of some of that excessive fat that we don't want in the liver cells. It also helps improve insulin sensitivity, which is always very important for our overall health. Normally, I recommend about 150 minutes of moderate intensity workout per week. However, if you can do even more, that's usually always even better. Number 4 is you want to control your blood sugar levels. High blood sugar levels can actually worsen fatty liver. For that reason, if you have diabetes, you want to make sure that you're doing everything that you can to control your diabetes and keep your numbers in the range that you should. Number 5 is limit alcohol. It's no surprise that alcohol can actually worsen liver disease. Therefore, if you have fatty liver, and even if you don't, you should watch your alcohol intake. But especially if you do have fatty liver, you want to be careful and you want to limit your alcohol intake. And it is something you should discuss with your provider as well. Number 6 is avoid rapid weight loss. Losing too much weight too quickly is actually not beneficial for you, and it can harm the liver. Therefore, you want to make sure that you're losing weight gradually. Of course, we want you to lose weight because one of the main treatments of fatty liver is weight loss. But we want to make sure that you're doing it and you're sustaining it in a slow, gradual manner. Therefore, you're exercising, you're eating as well as you can. Don't go on these diets that are, lose 30 pounds in a month or whatever those diets may be. Number 7 is supplements. There are some studies that suggest that things like vitamin E may actually have positive effect on the liver. If this is something that you have, you definitely want to discuss with your doctor and make sure that they are on board with you taking supplements that may protect your liver. Number 8 is manage your cholesterol levels. Obviously, no surprise there. You want to make sure that you're not adding more fat to the problem that's already gone. And you want to make sure you're eliminating foods that are high in cholesterol. You want to include heart healthy fats, such as fats that are found in avocados, nuts, and olive oil. Number 9 is obviously stay hydrated. We know that hydration is so important for our overall health. It's also very important for our liver health. So make sure you're drinking plenty of water. Make sure you're eating as well as you can. Try to lose some weight if you're overweight or obese. Stay positive and do the very best that you can every single day. I hope you guys enjoyed this video. Please comment below. I'll see you all on the next video.